Hello everybody, we are going over degenerative disc disease in the video today. We're going to answer 5 questions that a lot of people ask on Google, so I'm going to answer those questions for you. We're going over what is degenerative disc disease. We're going to talk about what happens and symptoms that arise with it. We are also going over, can it heal on its own? Best thing that you can do for it. And how can you prevent it from getting any worse? So those are the 5 things we're going to do. We also have some timestamps on those questions. So if you only care about a couple of them and you want to fast forward and check out the answer to those, feel free to do so, okay? My name is Dr. Dawn. I work at Performance Place Sports Care, just one part of the locally world famous chiropractors here in Costa Mesa. And if you guys like this video, you want to know more about DDD, if you want to know some exercises that you can do for your low back pain, neck pain, whatever it may be, check out our channel and search whatever you got going on because there's tons of resources there for you to take advantage of, all right? So we're going to get right into the first question. We asked Dr. Google, what are people asking about degenerative disc disease? And the first question is they just want to know what it is. Is it really truly a disease? And so the first answer to that question is no, it is not a disease. Calling it degenerative disc disease makes it very scary, makes it something that's debilitating, makes it feel like something that you have to deal with the rest of your life. What it really truly is just a progressive process that usually occurs with aging but can be sped up just by improper movement at a certain joint. And so we're talking specifically about the low back today, the lumbar spine. And so really it's not a disease, it's nothing to be fearful of, it's just something that happens with age and it can be slowed down. We can talk about some things that you can do for it. So when Google scares you about, this is a disease you have to live with for the rest of your life and it's debilitating, don't listen, okay? Listen to me. The second question that a lot of people want to know the answer to is what specifically is it and when symptoms arise with it. So we're going to use a couple models right now to talk about what exactly it is. If we look at our Mr. Skeleton friend here, okay, we're talking specifically again about the low back, and we're going to take just a chunk of the spine here, and we're going to zoom in on this little model to talk about it right in here, okay? And so just a simple anatomy of what's going on with DDD is above and below here. Above and below here, we have 2 vertebrae, one here and one here, and the disc is right in between those 2, okay? This white space here, there's a certain height that we have, and when we're talking about degenerative disc disease, what occurs over time is the height of this disc actually starts to decrease, okay? The disc is made up of jelly material, liquids, all kind of stuff for shock absorption throughout our life, and as we age, we start to lose a little bit of that. When we ask this area, specifically a part of the joint of the spine, to do too much stress because something else isn't helping, that can speed up that process of all of the liquid and juices that are in there that are helping create some of that shock absorption. So if we look at other little parts of this model here and some structures, if we think about the height and how much this is helping us here, okay, well, if this starts to decrease in height, then what happens at the hole where this right here, our spinal nerve, comes out of? That also starts to decrease in height. So some symptoms that can arise with that is whatever is supplied by this spinal nerve. Could be, if we think about some area of the low back and what the spinal nerve supplies, it could be the hip, the groin, the quad, sometimes even sciatica-like symptoms, sharp shooting pain down the leg, into the glute, numbness and tingling. All of those occur when that spinal nerve becomes affected because the bony canal that it's coming out of is becoming a little bit smaller, creating a tourniquet on that nerve, and anything supplied by this nerve starts to get pissed off. Could feel like soreness, sharp shooting pain, numbness and tingling. Everybody describes it a little bit differently. Could be all of those things or just one. So that's just one symptom that can arise with the degenerative disc disease. A second one that's usually pretty common is if we look back here on the back part of the spine, we're looking at the facet joint here, okay? And so in the facet joint there, what that one is really resisting, or the most common thing that that joint does in the spine is actually prevents too much extension in the spine. So going backwards like this, okay? Or people who tend to start to lean into a posture like this over time and they're walking around in this type of position, we're using that small little joint in our spine in the low back there over time. And so what happens is when you ask too much stress in one specific area, extra bone starts to occur and grow in that spot because you're asking more and more of it and it needs to adapt to that stress. So you could get local pain that occurs in the low back because of this as well. So again, decreased disc height here, more stress on the bone here. This usually feels like more local pain. You could probably point to it with one finger where you feel it. It hurts right here specifically. Sometimes facet joint pain can go down into the upper glute, side of the hip, sometimes even around to the front of the hip here as well, okay? So that's another symptom that usually arises. Again, one more thing, because you may notice this on just some imaging that you get done for degenerative disc disease, is that bony growth around this area also can affect that spinal nerve as well. So if you get little growth like bone in that area, it can also be another way that this nerve gets entrapped, and then again we get the numbness, tingling, sharp shooting pain into the muscles of the area supplied by the spinal nerve, okay? There's a couple of different things on imaging that you may have noticed. You get an MRI, or usually x-ray is what most people will do at first. MRI is usually secondary. You'll hear things like big, bad, and scary, like facet hypertrophy, osteophytes, decreased disc height, things like that, all that come along with degenerative disc disease. I just explained all of those to you there. They sound like big, bad, scary words. It's just a normal part of the aging process most of the time, or just a way of your body trying to stabilize the area. Like I said, it can be sped up by improper movement of that joint. So the bone grows like little fingers trying to grasp onto something, trying to find stability, because something around that joint, like muscles, are not activating properly to create the stability. So your bone's trying to do it. And that can create some pain as well going on in that nerve. So let's get into the next question. People want to know, can it ever heal? Degenerative disc disease is, again, a progressive process that occurs. It doesn't just reverse on its own, okay? That's not usually something that your body can just heal naturally. With that being said, that doesn't necessarily mean you always have to have pain. So when we're talking about pain and what's causing the pain, that can definitely be dissipated and improved, but the disc height itself cannot naturally be grown back or anything of that sort, even if I'm saying that properly. But there are some surgical options out there if you do want to look into, depending on how bad the degenerative disc is. They're doing disc replacements these days. They're doing injections for pain. They're doing different types of injections for being able to just promote better growth in that area or healing. All of those things are out there, and those are questions for your orthos. If you wanted to know more about those, ask them specifically, because that's their specialty, but they are out there for you if that's something that you're interested in. If you're just looking on how to decrease or how to slow down the speed of this process, or how to help mitigate the pain that you're having, those things can be done through your chiro, through your PT, through other pain management types of people who really specialize in movement and active care. Because like I said, usually this occurs because there's improper movement in an area, so you need somebody to look at you. How have you been moving for years? How can we reverse that process, and how can we stabilize around the area? So the question for best thing to do is that. Check out somebody who's really good at looking at movements, movement specialists, chiros, PTs. They'll give you exercises to work on things that you can do on your own to help improve your movement throughout life and decrease pain. So last question that we're going to talk about is, how can you prevent the pain from getting worse? We're going to get a little bit more specific into just that question I answered before, of a specific movement that you can do, that you can start. The first part of this is decreasing pain, right? So that can be a position you get yourself in, or an exercise that we do that helps promote some stability to decrease pain. That's just part one of the whole process here, but I'll just dip our toes into part one today, and we're gonna get on the floor and we're gonna do an exercise. So if you have this, if someone's done imaging on you, told you have degenerative disc disease, I hope this information helped. But what we're gonna do now is try to see if, what we're gonna do is get on the floor and see if it helps decrease some of your discomfort, okay? So I'm gonna bring this bench around here, and we're gonna lay on our back. I always tell people who are watching the videos, if you have current pain going on, to know if this is gonna work for you is to test where your pain is at. So if you're just sitting down right now and you don't feel anything, maybe get up and try some things that usually create a little bit of discomfort for you to see if this exercise helps, okay? So go walk, maybe go get up and out of a chair, whatever it is that you need to test, go test it, and then try this and go back and see if it helps at all. So we're gonna lay down. You can put your feet up onto a chair, onto a couch, something that keeps your knees at about 90 degrees here, and we're gonna lay all the way down. Usually what happens with most people is they're gonna have a little bit of space in the low back here that they can run their fingers through, just naturally what happens in the spine as we lay down. We're gonna work on creating more space around that disc area by actually pushing our low back into the ground. So what that looks like is trying to squish a bug between our spine and the floor. This can be tricky for some people, so take a second to just kind of play with it here. You should feel like your entire back is flat to the ground here. If you're having difficulty with that, what you can do is put a little bit of pressure through your heels where they are on your couch or bench or chair. About 5 pounds of pressure, nothing crazy, but you'll see the exact same movement happens if I just do that as well. So pick which one works best for you, find a nice flat back to the ground, and then we're gonna work on some breathing. Breathing doesn't seem like it's gonna do much for degenerative disc disease, right? But actually when we do it properly, and we build a full 360 support around the spine, we can create decompression, which releases the tourniquet of the nerve and takes stress off those joints we talked about. So the first part of this is fingers right where the pointy bone on your hips are right here. So find that pointy bone, go right inside of it there, and we're gonna try to breathe into our fingers. This one can be difficult for some, so pause the video if you need to and practice it. If you're doing it properly, you're gonna see that your fingers are rising to the ceiling because your breath is expanding into that area. So that's part one, front part of the abdominal wall here. Now we're gonna look at where my thumbs wrap around the side of me here, and I'm gonna try to breathe into that spot now, which is a little bit more difficult. If you're doing it properly, your thumbs are going to expand wide here. So again, breathe into the pointer fingers, and a little bit more into those thumbs. And we're gonna practice that for a little bit. This entire time as we're breathing, we're not losing that flat back to the ground here, okay? At any point, if this becomes difficult for you, you just practice the hardest thing that you can do best, okay? So if it's just the breathing right now, then just practice the breathing. But we're gonna progress through this for people who are getting this really well or who have practiced it. If we're feeling like we're getting that full 360 breath around the entire waistband of the pants here, we're gonna add some movement into it, okay? We've probably been moving improperly for some time now, so we wanna see, can we stay stable through here as we go through some movement, all right? So we're gonna take a breath in, and we're gonna try to lift a leg. And we're gonna do that again. And then we're gonna try the other side too. And what we're looking for here as we go through just some simple leg movements is, are we staying stable through here? Sometimes what you'll notice is as we lift the leg or as we're starting to put it back down, you'll feel like you lose a little bit of that contact to the ground or a little bit of that pressure through the belly with your breath. So there's two parts to it, keeping flat back and keeping expansion into the belly as we go through. Okay, so pause the video and practice that as much as you need to. But what we're gonna do is add some pressure now as well. So flat back, breath in, lift, press, and then let it go. And switch to the other side. Press, and let it go. We can progress through this in so many different ways, but I'm gonna leave you guys with just this part. Learning how to stay stable, move, find a little bit of effort there, and letting it go. We can always take the bench away and go through bigger leg movements if we need to. Find whatever's challenging for you guys, but let's just dip our toes into some decompression breathing and some movement through the legs. Get up and retest whatever was hurting you before and see how it's feeling now. I'm sure that you'll see a little bit of improvement with that. So, if you guys like this or you want to know maybe what are the next couple of steps after finding decreased pain in this type of movement, we want to take this movement on the floor and transfer it into your movements throughout the day, like getting up and out of a chair or getting you back to some sort of exercise that might be your goal. We want to find that stability through the spine, decrease what's happening with degenerative disc disease there, try to build up some support around the area and get you back to your goals. So we can do that in person or virtually, depending on where you are in the world. So reach out to us in a couple of different ways. There may be a gift that pops up on the video. We have different ones that change all the time. So take advantage of whatever's popping up on the video there for you. It's there for you to use as a resource. There is also a link in the description that you can click on. So click on that link, see where it takes you, and just find where these next couple of steps are. This doesn't always have to be a super scary thing that you're dealing with the rest of your life. There's some answers here.